Why do stroke survivors experience uncontrollable irritability? Imagine going through a major life change and feeling overwhelmed, but your emotions seem to take over in ways you can't control. That's often what stroke survivors experience with irritability. When a stroke occurs, it can cause damage to specific parts of the brain that are responsible for managing emotions. The areas most affected are usually the frontal lobe and parts of the right hemisphere. These regions help us regulate our feelings, control impulses, and respond appropriately to different situations. When they are damaged, it can lead to increased feelings of frustration, anger, and mood swings that seem to come out of nowhere. The frontal lobe acts like the brain's emotional manager. If it gets injured, a person might find it harder to keep their emotions in check. This can result in sudden outbursts of anger or irritability that are disproportionate to what's happening around them. Some stroke survivors develop a condition called pseudobulbar affect. This causes them to laugh or cry unexpectedly, often without any clear reason. It happens because the connections between the frontal lobe and other parts of the brain, like the brainstem or cerebellum, are disrupted. This emotional instability can be very confusing and distressing for both the survivor and their loved ones. But brain injury isn't the only reason for irritability after a stroke. The emotional toll of recovering from a stroke can be just as impactful. Survivors often face feelings of grief over lost independence, physical limitations, and uncertainty about the future. These stressors can make it harder to tolerate frustration or stress, leading to irritability. Depression is also common after a stroke and can intensify mood swings and emotional outbursts. The combination of physical changes, emotional responses, and psychological struggles creates a complex picture of how irritability develops. Research shows that the location of the brain damage plays a significant role. Damage to areas involved in emotional regulation, such as the frontal lenticular-capsular pontine regions, can directly affect mood and behavior. Neurochemical changes, especially in serotonin pathways, also influence mood and can lead to increased irritability. Additionally, difficulties with speech or mobility can cause frustration, making emotional responses more intense. Pre-existing personality traits or a history of mood disorders can also influence how someone reacts emotionally after a stroke. It's important to remember that about 1/3 of stroke survivors experience some form of emotional disturbance, including irritability. These feelings can impact daily life, relationships, and overall recovery. That's why a comprehensive approach to management is essential. Medical treatments like certain antidepressants, such as selective serotonin reuptake inhibitors, can help stabilize mood. Psychological support, counseling, and emotional regulation therapies are also valuable. Open communication with healthcare providers allows for personalized care tailored to each individual's needs. In the end, uncontrollable irritability after a stroke is a result of a complex mix of brain injury, chemical changes in the brain, and emotional stress. Recognizing these factors helps in understanding why these feelings happen and highlights the importance of holistic treatment. If you or a loved one are experiencing these symptoms, it's crucial to seek guidance from healthcare professionals who can offer appropriate support and strategies to improve emotional well-being. Remember, recovery is a journey, and managing emotional health is a vital part of that process.